Hi, my name is Dr. Daniel Perez. I'm a board-certified, fellowship-trained foot and ankle surgeon. Work at Precision Orthopedics and Sports Medicine based in the greater DC area.
All right. Today we're going to be discussing the universal hook plate. Specifically, this portion is going to be for the fibula, for a fibular fracture. They typically are used for a Weber B or a transverse type fracture or an avulsion type fracture of the distal aspect of the fibula. We start with a central incision over the fibula, starting at the very tip of the distal aspect of the fibula and coming up centrally on the fibula. Depending on the location of the fracture, we have two different plate options. There's a 4-hole and a 6-hole option. Today we will be using the 6-hole option. So care is taken not to disrupt the ligaments distally. Once reducing the fracture, you have the option of temporarily reducing with a K-wire or using the guide to hold temporary fixation with the use of the central aspect of the guide. And this can be later used for a 4-0 cannulated screw to hold compression. If you want additional fixation, there's temporary K-wire holes above centrally. Now we're going to drill for the tine placement with a 3/5 drill bit. And you can further seat it with a tamp. So next we're going to insert a non-locking screw in the more proximal portion of the eccentric hole. And this is typically bicortical. Options for the eccentric hole, we can use a 3/5 or a 4/0. The 4/0 has more of a cancellous pitch, so if you're not going to go bicortical, it might be a good idea to stick with the 4/0. At this point, we can further tamp to further seat the plate onto the bone. And at this point, we can finish filling in the holes with your option of 2/7/3/5 or 4/0 screws, locking and non-locking. Since the plate's sitting up, I'm going to use a non-locker to suck down the more proximal portion. Next, I'm going to place a locking screw in this hole. Next, I'll be placing a 3/5 locking screw. The nice thing about these screws is that they have a dual lead interface so that they tend to go in faster than a traditional screw, and they have 30 degrees of angulation in any direction to be able to lock into the plate. That I appreciate with the locking technology is that it has a hard stop, so you can actually feel when it's completely set and locked into the plate. Next, we're going to be placing a cannulated screw through between the tines, and I'm leaving the distal screws open to avoid the screw from irritating them, and also because this is where the fracture typically is. Next, we'll use the cannulated drill bit and place our cannulated 4/0 partially threaded screw. Guide wire is removed. And layered closure should be performed.